I'm Dr. Rita McGuire. I am the Chief Medical Officer here at Wakana. I'm also one of the co-founders, and I want to welcome each and every one of you to our Doctor's Edition. Every Tuesday at 7 p.m. Central Standard Time, we host this webinar not only to educate healthcare professionals about the amazing medicinal benefits that the cannabis plant offers, but also lay people. There are a lot of lay people that are on the line that absolutely need to hear this information for themselves, and also to take back this information to their physicians or healthcare providers. So here at Wakana, we have a medical advisory board. We also have some additional consultants, medical professionals, like our guest tonight, Dr. Joseph Rosado, who really helps us to navigate our way in this industry. But our medical advisory board is made up of physicians, registered nurses, we have clinical psychologists, we have chiropractors, we have dentists, we have therapists. So it is absolutely such an amazing board that gives us and feeds us into us a lot of information about CBD. So that's what we're going to be talking about, but a little bit about myself. I am an obstetrician gynecologist of over 30 years. I trained at Wayne State School of Medicine in Detroit, Michigan. I completed my residency at Cook County Hospital. I'm CEO of RJM Wellness and Ripped Rita Fitness. I'm a global women's health and wellness speaker. I'm one of the certifying physicians for medical marijuana program here in Illinois. In fact, I testified in front of the Judiciary Committee when Illinois adopted their adult use law, the recreational use law. So yes, I was summoned by the governor to present that information. I'm also a member for Doctors for Cannabis Regulation. Again, I'm one of the co-founders and the Chief Medical Officer for Wakana for Life. One of my new business ventures, I'm an owner of a fat loss camp in South Florida. I'm also an MBA candidate, studying to receive my MBA in the May of 2022, as well as I'm a trichology instructor candidate. I will be graduating in November. So super, super busy, some exciting things going on in my life. But you know, in 2017 is when I was introduced to the cannabis industry. And it brings back what Dr. Sanjay Gupta had to figure out, right? In 2009, Dr. Sanjay Gupta said no to cannabis. But he had to turn around and make a public apology in about 2013, 2014. And what he said, we have been systematically misled about this plant. He said, as a physician, I didn't dig deep enough. I didn't look at the research and the data from other countries. It wasn't until he traveled the world. He spoke to medical experts. He spoke to lab experts. He spoke to patients all over the world that found healing, found wellness in the cannabis plant. So he had to come back and make a public apology that we have been systematically misled about the medicinal properties that this plant offers. And so 2013, 2014 is when we really saw this cannabis industry becoming mainstream. But why is it that so many healthcare professionals, they're still thumbs down, right? Many of my colleagues absolutely won't even listen to a word that I want to tell them about this plant. And it's really mainly because they don't teach in medical school or any other professional school, be it pharmacy school, dental school, chiropractor school. They don't teach about the medicinal properties of cannabis. They don't teach us about the endocannabinoid system that you're going to learn about this evening. So that's why many, many physicians are still saying no when their patients are asking about CBD. It's really the rage amongst most patients, but it's really launching many physicians into uncharted territory. And this is why this forum, this platform, excites me. It's an opportunity for lay and healthcare professionals to engage in a conversation about CBD. So let's talk about the plant, cannabis. Now, the cannabis plant has two species. It has the marijuana species. That's the species that gets you high. It gives you the euphoria, the paranoia, the munchies, right? But there's another side of the plant, and that's the hemp species. It doesn't get you high. It doesn't give you a euphoria. It doesn't give you a paranoia, but it gives you all of the health benefits that you're looking for. So marijuana gets you high because it has high levels of delta-9 THC. That's the cannabinoid or substance that gives you the high. But on the other hand, hemp has THC in it, delta-9, but at very, very small amounts. In fact, by definition, hemp is defined as containing less than 0.3% or less of delta-9 THC. So all of our products here at Wakana are sourced from the hemp species of the cannabis plant. And yes, hemp is legal in all 50 states to consume, cultivate, and to sell. So the products that we're going to be speaking of tonight, the information that we're going to be speaking about tonight is about the hemp side of the cannabis plant. So let's dig a little bit deeper with CBD. See, CBD is really the hero. CBD has a long list of medicinal properties and benefits to the body. CBD is an antibacterial. That's why we're seeing CBD being used in so many hair products and facial serums, because it addresses acne and psoriasis and eczema. It also inhibits cancer cell growth. We're going to talk about that this evening, right? It helps cancer cells from metastasizing, from spreading. We also see it being used to reduce symptoms of those who are undergoing cancer treatment, like nausea and vomiting. CBD reduces seizures. It helps to reduce pain. It helps to reduce inflammation. It helps to reduce anxiety and depression, and even other mental illnesses like schizophrenia. It also helps to reduce the risk of arterial blockage, so coronary artery disease. It reduces inflammation in the pancreas, so it's very beneficial, not only in helping to improve blood sugar levels in diabetics, but improving blood pressure in hypertensive patients as well. So CBD has a long list of medicinal properties, but there's other compounds that the plant makes, like CBG and CBC and delta-9 THC and delta-8. Delta-8 is the new kid on the block, right? You're going to hear a little bit about delta-8. But all of these compounds synergize on a cellular level to really give such amazing results for those who are looking for a more holistic, organic way of addressing their health. So the science behind how CBD and the other cannabinoids work in the body is called the human endocannabinoid system. In fact, this system was discovered when I was in medical school, right? I'm telling my age now, in the early 1990s. Though in the 60s, Israeli scientist is Raphael Mechoulam. He actually discovered THC. He discovered these receptors that are in every single organ in our gland, in our body, every organ and gland in our body. He really discovered these things in the 60s, but in the 90s is when everything was put together. And what he found was that when you consume cannabis, there are receptors in our body that are looking to bind with cannabis to put our body in balance or homeostasis. So the science is there. So CBD is not a snake oil. It's not a magical potion. All of the other cannabinoids that the cannabis plant makes work very much like when you have a headache and you take Tylenol, right? You take Tylenol, you often wonder, well, how does it work for my headache? How does it work for my pain? The same mechanism of receptors sending signals to pain perception areas in the brain, or sending signals to areas in our joints to reduce inflammation, is the same exact science on how cannabis works in our body. So it's very, very fascinating. So what I want to do before I bring up my guest speaker, I want to introduce you to the products that we have here at Wakana. And the reason being is that we're going to put all this together. We're going to put all of the information that you learned about hemp and CBD and the endocannabinoid system and these products, and we're going to talk about some challenges that many of you have on the line. Challenges like pain, arthritis, diabetes, hypertension, prostate cancer, anxiety, insomnia. We're going to put all this together so it makes sense. So there are many, many CBD products out there, right? I'm sure many of you have seen CBD products at the gas station, at smoke shops, at video stores, right? Family Video used to sell CBD products. But those are products that you have to be very suspect about, right? You want to ensure that the products that you're taking have been tested, right? Because hemp is a bioaccumulator. So when you grow hemp, if it's not in organic soil, you're getting pesticides and heavy metals and Lord knows what else in that CBD product. So just to let you know that the FDA has not approved any of these statements. If you're not over the age of 21, you're not allowed to sell, consume these products unless your parents have that discretion to do that. But these are really important details that if you are under a doctor's care, if you're on multiple medications, you want to let your physician know that you are taking CBD. So I talked about testing. Our products are third-party tested. That validation is key. That validation allows you as a customer to be very safe. The products are tested for mold, mildew, heavy metals, pesticides, that the product is being sourced from the hemp species, that the legal limit of THC is in the product, which is 0.3% or less. All of these things are very important when you are internalizing products. So our products are certified and they all come with a certificate of analysis. So this is our lab. We partnered with one of the top ISO labs in the state of Florida, Green Scientific. I am in Florida every single month or twice a week, every month. And so I get to visit with all of the chemists, the chief scientific officer, to ensure that our products have the highest quality of testing that they can get. The instrumentation in these labs, or our lab that we've partnered with, is top-notch instrumentation. So I am very, very proud to be a partner with Green Scientific Labs. So our products are really very, very unique because we have products by industry. So we have weight loss products, we have skincare products, we have essential oils, we have hair care products. We have even products for sexual enhancement and overall wellness in the immune system. We have tinctures. Those are products that you place underneath your tongue. And what I love about our tincture line is that we have a product line that is a broad spectrum line. Those are our pure products. So whenever you see a product in a white label, that means it's safe to take if you have random drug screens at your job, right? And then we have power products. Those are all of our products in the black label. Those are products that have the legal limit of THC, which is 0.3% or less. We have potency that ranges from 300 milligrams all the way to 900 milligrams of CBD. We also have topicals. You know, topical products are great to address local relief that you may need, that sore knee, that sore back, that shoulder. It addresses symptoms that come from sciatica, neuropathy, All of these products can be placed topically, and safely you can pass a urine drug screen because topicals don't pass in the blood-brain barrier. So we have many topicals that come in a salve form. We have a liquid form, a rollerball form. We have a serum for the face. We have a body cream and body butter. So those all address inflammation, pain, skin challenges like psoriasis, eczema, and acne. We also have edibles. Oh, our edibles can't even stay on the shelf, right? We have gummies. We have gummies that those who have random drug screens can take, our pure gummies, our broad spectrum gummies. And then we have our full spectrum gummies, our power gummies. We have what is called Delta 8. Delta 8 is the new cannabinoid on the block. And Delta 8 millennials love because Delta 8 really allows for all of us, you don't have to be a millennial, to really allow that creativity, that focus, that energy that you need sometimes. We have a flat belly coffee. Yes, we have a coffee infused with CBD that helps to reduce your appetite, suppress those cravings for carbs and sugars, and allows for that belly, that gut to be a lot smaller. We have flat belly gummies. We have an immune defense tea. We have a bitter tea. So we have a wide range of varieties of our edibles. We even have smokables. What I love about smokables, cartridges and pre-rolls, is that they act very quickly. Within 1 to 5 minutes, this CBD is in your bloodstream with a smokable, 1 to 3 pulls on a smokable. So for those times when you're nervous about talking on a webinar in front of a large crowd, or maybe you've got some anxiety, maybe you've got some insomnia, you're trying to go to sleep, smokables are a great way to address acute issues. And then sexual health. Sexual health is very important, right? As women get older, they become menopausal, they have vaginal dryness, vaginal atrophy. We have a CBD lube to enhance the sexual arousal. We also have KOJ, King of the Jungle, for those who need a little help with their libido. It could be a man or a woman. We have different body butters, seduction butters, all infused with CBD. We have products for the kitchen. Lots of people like to cook with CBD, spices, vegan butter. We have a culinary tincture that you can bake and cook with. So just a great way to even infuse your favorite recipes. Our hair care is one of our newest line. We understand with COVID, we saw a lot of people with COVID hair loss. CBD attacks that follicle so that the hair can grow, right? As long as there's a follicle there, the CBD will help to improve not only any thinning that has occurred, but hair loss. So we offer shampoo, conditioner, detangler. We have a styling cream and even an oil for men who have thin beards and need help in that area as well. So there's so many great choices. You can't go wrong with any of our products here at Wakana. So let's move on to our guest speaker. Dr. Joseph Rosado is one of my very dear friends. In fact, I looked up when he was last on our webinar, and it was August 20th of 2020. He is an internal medicine physician out of Florida, the Orlando area. He is also very, very involved in, I met him through the Minorities for Medical Marijuana. I'm a part of that group. He is very involved in really educating and helping Black and Brown communities understand that there is a lot of healing that this plant offers. He is the author of Hope and Healing. It's a case for cannabis. He talks about so many different challenges, from cancer to HIV/AIDS, Crohn's, PTSD, chronic pain, Parkinson's, dementia, multiple sclerosis, glaucoma. The list goes on and on. You really, really want to get this book, Hope and Healing, A Case for Cannabis. And I'm just so excited because my friend just won a huge award. It's an Outstanding Achievement Award in Wellness Programs. He won this award, I think, just a month back through the Volusia County Hispanic Chamber of Commerce Healthcare Awards. Congratulations to you, Dr. Joe. So tonight, what Dr. Joe and I are going to tackle are some different scenarios. We're going to talk about the use of CBD on symptoms that arthritis or pain can cause, insomnia. We want to touch on insomnia, CBD in anxiety and depression, blood pressure. A lot of questions about CBD and its use in reducing blood pressure, blood sugar and diabetics, and last but not least, cancer. We can talk about prostate cancer. I think we have a guest on the line that asked me specific questions about prostate cancer. So I'm going to stop sharing my screen and I'm going to bring to the stage Dr. Joseph Rosado.
How you doing, Dr. Rita?
I'm great. I'm doing great. Thank you for joining us.
Always a pleasure to be on stage with you, even though it's virtual.
Even though it's virtual, that's right. So let's tackle our first topic, and that's CBD and pain. That's one of the top reasons that folks choose and go to using CBD for pain. They may have arthritis, they may have neuropathy, sciatica. Let's talk about that first, Dr. Joseph.
Well, I'm glad you brought that one up because that is the #1 reason for patients coming to the office for medical cannabis or to get their medical cannabis card, which is to get relief from pain and get off of the opiates and get off of the muscle relaxers and get off of the anti-inflammatories that cause so many problems, far worse than what cannabis can ever cause, much less CBD.
And how does it work for pain?
Well, the best analogy is CBD is an excellent anti-inflammatory. Now, what does that mean? Anti means against, inflammatory means inflammation. So it works very well against inflammation. As you touched on the endocannabinoid system earlier, we all have an endocannabinoid system, meaning we produce cannabinoids. Granted, it's not the same structure as THC or CBD or CBG, but we produce cannabinoids that work on those same receptors. What happens is when we get into a clinical endocannabinoid deficiency and we do not produce as much of our endocannabinoids, we need cannabinoids from the outside to come in and help replenish what we are unable to produce on our own. That's where you and I come in making our recommendations for the proper cannabinoid to purchase, to use for their specific condition. So people that choose to self-medicate, although they all have an endocannabinoid system, it's not the same as if you have someone such as yourself or myself to walk them through the process and the journey. Not everyone is a Tommy Chung that has tons of experience using cannabis. So we have a lot of people that we have to work with. We have these receptors in all of our joints. And so arthritis, arthro means joint, itis means inflammation. So that's all arthritis is inflammation of the joint. These joints have these cannabinoid receptors, and by using the CBD, it helps reduce the inflammation in those joints, which in turn is going to reduce the pain.
Phenomenal. And you know, at Wakana, we have amazing products that can be topically used. They can be internally used with a tincture or a gummy or a smokable. And I always talk about layering our products, you know, using more than one so that CBD is in a steady state at all times.
Exactly. You want to use multiple products, not just one, because as you mentioned, when you inhale, the effect takes 1 to 5 minutes, 3 to 10 minutes, depending on how you metabolize, but the effect only lasts 2 to 4 hours. So that means you would have to be either doing a pre-roll or hitting your vape pen every 2 to 4 hours. But if you do an inhalation with your pre-roll or your vape pen, and at the same time put some of the tincture under your tongue and eat a gummy, now you're going to be covered better longer, because as the effect of the vape starts to wear off, the effect of the oil that you put under your tongue that takes about 90 minutes to kick in is going to kick in, and that's going to last anywhere between 4 and 6 hours. And as the effect of that wears off, you're going to get the effect of the edible, the gummy, or a capsule, if you choose to take a capsule, that takes about 2 hours to kick in. So now you're covered better longer, and then you would just use the vape pen for what's considered breakthrough pain. For any of you that are with us today that have been to a pain management doctor, they typically give you a long-acting opiate and then a short-acting opiate for breakthrough pain. We're using the same type of method, using all of the different modes of administration, and the vape now becomes the breakthrough pain medicine, and then the other ones are your long-acting and intermediate acting.
Ooh, I love that analogy. I love that analogy with opiates. Many of the attendings here have, I'm sure, been to pain management physicians that have put them on opiates for that reason. What about fibromyalgia? That was a question about fibromyalgia. Is that
fibromyalgia? Yeah, oh yeah, that's huge. And again, the fibromyalgia is one of the 3 conditions that Ethan Rousseau speaks about clinical endocannabinoid deficiency. The 3 conditions that he names specifically are migraine headaches, irritable bowel syndrome, and fibromyalgia. And these are all directly related to clinical endocannabinoid deficiency. So by supplementing with a reputable CBD product, you're going to replenish not only the CBD, if you're using the whole, either a full spectrum or a broad spectrum, because the difference of one versus the other is the difference in THC. And in the United States, it's 0.3%. For my international viewers, if you're south of the border, it's 1%. So it depends what country you're in, and it's not a botanical definition. It's a political definition. It's a government definition. It's not based on botany. It's based on government. So let's not get that twisted either. But in the U.S., to sell legally over the counter, it's 0.3% or less. So if you're using either a full spectrum or a broad spectrum, you're getting all of the different phytocannabinoids. So not only are you getting the CBD, but you're also getting the CBG, which is 5 times as powerful as CBD as an anti-inflammatory. So it's the combination of all of them to help stimulate the endocannabinoid system and all the different receptors that are found in the body, because it's not just CB1 or CB2. You also have GPR55, you have TRPV1, 2, 3 that are found in different areas, different blood cells, etc.
phenomenal? Thank you, thank you. Let's move on to one of the second reasons folks choose to take CBD, and that is insomnia. How does CBD work in improving insomnia?
The way CBD works to improve insomnia is that it helps with anxiety. The biggest problem that insomniacs have, present company included, is that our brains don't shut down. I mean, you quoted all the stuff you're doing, you know all the stuff I'm doing, and so our brains are constantly going on. You know, I'm the medical director of 6 different clinics, and right now we're in the forefront of this pandemic, dealing with all the craziness that's going on in the state of Florida, which happens to be the epicenter for it. And it's just ridiculous, all the protocols and policies that we have to implement to make sure that everyone's getting tested properly, et cetera, and treated properly. And so my brain is constantly going, creating processes, protocols, policies, you know, over and over and over. And for me to shut my brain down, I need to address that. And so by taking the CBD, or personally, what I use is Delta 8.
Oh, we love Delta 8, Dr. Joseph. We love Delta 8.
Now, some people, it stimulates them. It gives them energy. In my case, it calms me down. It helps me get to sleep. And so in conjunction with the vaping of a Delta 8, I also add an edible. That combination, one puts me to sleep, the other one keeps me asleep, and I sleep through the night, primarily because I shut my brain down. Once my brain is shut down, there's nothing to keep me awake because I'm no longer thinking.
You know, I love that combination. You know, our Delta 8, if you're on the line, do not eat the entire gummy. Our Delta 8 is a quarter of the gummy. But again, as you heard Dr. Joseph speak about, using one product typically is not enough. You absolutely need to layer these products, so as one is short-term and acting quickly, the other is in the system 6 to 8 hours to keep you asleep, so that you're waking up restored, refreshed. You know, our immune system resets itself when we sleep, so we've got to get good restorative sleep. Thank you. Well,
and because I'm above the age of 50, I tend to get up in the middle of the night to empty my bladder, because I do have an organ called the prostate, and I have my vape pen next to my bed. So if I get up in the middle of the night to go to the restroom, which since I've been using cannabis, I don't get up as much because of the anti-inflammatory processes. It keeps the inflammation under control. But if I come back to bed and for whatever reason, I can't fall right back asleep, I don't waste any time. I grab my vape pen, do a couple of hits, and I like to do 1-second inhalations. Some companies recommend doing a full 3-second inhalation, but all you're gonna do is hack along. You're gonna be coughing because that's too much coming in. So I do 3 1-second inhalations, do some breathing exercises, and that's enough to put me back out.
And that's exactly what we recommend and we teach. 3 puffs is all you need. Wonderful. Well, let's move on to, because you touched on anxiety. Let's move on to hypertension, high blood pressure. It's another big question and its role with CBD.
Earlier, well, the last live presentation I did in 2020 was in February, and it was here in Orlando, and my topic was cardiovascular disease and cannabis. And there was a study that was done just solely with CBD, and you guys are going to freak out when you hear the dose. These were non-hypertensive patients. These were people that did not have an issue with high blood pressure. They gave them 600 milligrams of CBD, and every one of them, their blood pressure dropped. So from that point forward, they realized, okay, CBD does have an effect on blood pressure, because these were non-symptomatic, non-hypertensive patients, people that did not have this as a condition. They just measured their baseline blood pressure, gave them the 600 milligrams of CBD over an extended period of time, and they discovered that it lowered every one of their blood pressures. So if it has that effect on someone that does not have blood pressure issues, imagine what it's going to do to someone that does have blood pressure issues. And something that I always tell my hypertensive patients is monitor your blood pressure more closely than not, because the combination of blood pressure medication, and let's face it, the majority of our hypertensive patients have no less than 3 medications. They have a diuretic, something that's going to make them pee. They have either an ACE inhibitor, something that ends in pril, lisinopril, enalapril, and they're going to, or an ARB, something that ends in sartan, losartan, etc., and or a beta blocker. So those are at least 3. If you are of color, you're going to replace the beta blocker and add a calcium channel blocker like Norvasc, amlodipine. So that's standard. So if you're on these 3 medications already and you're adding the CBD, you need to be extra cautious, because from there, that's where we're going to start weaning you off each one of those medications little by little, to where you're no longer on that and you're just on the cannabinoids.
You know, that's music to so many of the attendings' ear when you say wean off slowly to nothing. The science is there, guys. You know, CBD is a vasorelaxant. It also helps to really open, you know, those blood vessels. It's reducing inflammation. Along with that, Dr. Joseph, we see patients who have erectile dysfunction improve with that because the blood flow is improved as well. Let's move on to diabetes, blood sugar levels, and its role with CBD as well.
I've seen more benefits with THCV and not so much the CBD, which is a lesser phytocannabinoid. But because the THCV has been shown to work on patients with metabolic syndrome. So it does normalize blood pressure, but THCV is also found in the hemp plant. So we're not talking anything that's not in the hemp plant. So that in combination with the CBD, because one of the problems of diabetes is inflammation. You have an inordinate amount of inflammation, and you have these excessive levels of sugar, and you need to address that inflammation. And so the combination of the CBD, which is not only an anti-inflammatory, but also an antioxidant, combined with other phytocannabinoids, as well as terpenes, is going to help lower your blood sugar. And again, monitor your blood glucose, monitor your blood sugar, because a lot of patients have been able to reduce the amount of insulin or oral medications. Perfect slide. That shows all of the different phytocannabinoids, and you see that THCV is right there, exactly. And it helps with metabolic syndrome. It helps lower blood pressure. It also helps lower and stabilize your blood glucose.
Wonderful. And I wanted to bring that slide up again to show our audience that our full spectrum, our power products, incorporate those cannabinoids like THCV, as well as CBD and CBG and CBN, etc. Fantastic.
And just because you get started on these products doesn't mean that you're going to stop taking your conventional medications tomorrow. It is a process, and it is a slow process. And you must work with a healthcare professional that understands the physiology and understands how these medications interact, because the same place where these medications are metabolized, so is CBD, so are the phytocannabinoids. So it's important to understand to prevent an adverse interaction between the cannabinoids and the conventional medications.
Fantastic. Our last topic is CBD and cancer. You know, I spoke about how CBD reduces the ability of cancer cells of spreading, of metastasizing. We also see CBD being used in oncology a lot for the nausea, the vomiting. But I think that if you could just expound on some studies, some data, outside of reducing nausea and vomiting, how would CBD help to improve those who have prostate cancer or uterine cancer, etc.?
My first 2 cannabis patients back in August and November of 2016 were cancer patients. One was a 35-year-old with stage 3 brain cancer, and the other was a 15-year-old, 15-year-old child with a stage 4 head and neck tumor. The 15-year-old is no longer with us. The 35-year-old is now 41 and is still with us. So the way CBD works is that it has a property called apoptosis. And what that means is it causes the tumors to shrink. And by causing the tumor to shrink, it in essence prevents the cells in the cancer cells from mutating, and as you mentioned earlier, it prevents metastasis, meaning the traveling of those cancer cells to other organs and then putting their seeds in those other organs and then having the cancer spread from one location to multiple locations. So it prevents the growing or the growth of the tumor by blocking that mechanism of mutation and recreation.
Very good. Wow. Sorry to hear about that 15-year-old, but we do know, when someone is diagnosed with cancer, it's a lot. There's anxiety, there's depression, many times there's pain because it's at an advanced stage. And so CBD can address all of those symptoms, can address the pain, it can address the anxiety, depression, it can address the insomnia as well. Well, thank you so much. We're going to answer some questions. Those are those quick topics we talked about. I think there was a question about cholesterol. Let's see if I can go to the very top. Yes, this is recorded. There are questions about depression. I think we talked about CBD replacing antidepressants. Again, you have to work with your physician. You never, ever want to stop taking your medications. You want to work with your physician so that physician can slowly wean you off of medications, right? As you're taking,
especially antidepressants.
especially antidepressants. Pinched nerves from bulging discs, causing numbness and tingling during the sleep. Can CBD help?
That's the anti-inflammatory process that we talked about. It reduces inflammation. It reduces inflammation of all tissues, not just the arthritis that I mentioned. It reduces inflammation in general. And again, combining the topical, allowing it to penetrate through the skin, and taking it systemically, so now you're attacking it both ways. And the example I like to give is if someone comes in with a cellulitis, an infection of the soft tissue of their arm, I'm going to give them an oral antibiotic and a topical antibiotic to work simultaneously, to work locally as well as systemically.
Fantastic. Does Delta 8 show up in drug tests? Delta 8 is a very, very, very close cousin of Delta 9. So if you have random drug screens, I would recommend that you not use our Delta 8 products, that you use our pure broad spectrum product. Delta 8 is amazing. It is absolutely a cannabinoid that is really causing those who have not gotten relief from CBD to get some relief. So if you have random drug screens, the Delta 8 is a no. Okay.
Aside from being a medical doctor, I'm also a medical review officer. I'm an MRO. I'm certified to read, interpret, and give information on urine drug screens, pre-employment screenings, etc. And I'm going to fill you in on a little secret. The only thing they test for is THC. Now, that being said, remember the difference structurally between Delta 8 and Delta 9 is where the double bond is found. In Delta 9, it's found at the 9th carbon for my biochemistry geeks that are listening, or organic chemistry geeks. So Delta 9, the double bond is on the 9th carbon. Delta 8, the double bond is on the 8th carbon, but it still is Delta 8 THC. So be mindful of that.
Thank you so much. We don't want anybody here losing their jobs. Wonderful. Let's see if there's any other questions.
I saw one about insulin.
Yes, yes, insulin. What if someone is on insulin? How would that work with CBD? Great question.
The same as with the oral agents, whether they're on metformin or Invokana or Actos, any of those medications are used to reduce their blood sugars, just like in the previous, in every one of those cases, the cannabinoids reduce the levels of sugar, the sugar levels. And by reducing them, you're going to find that you're not going to need as much. And so you can start reducing the amount of insulin, whether it's a basal, like a long-acting insulin, Lantus, Levemir, or a short-acting or intermediate, like 70-30.
Very good. Another question, are there any short or long-term effects on the liver while taking these products?
On the liver by themselves, no. In conjunction with other medications, for example, anti-epileptic drugs are the biggest culprit because anti-epileptic drugs have a very, very narrow therapeutic window. Let's say Depakote or valproic acid is the classic one. The therapeutic level is very, very narrow. And so combining that in conjunction with CBD, for example, especially in the pediatric population that I manage, because I manage a lot of children, we stagger. I tell the parents to give the oils or gummies or whatever the child is taking either an hour and a half before or an hour and a half after, never at the same time, because the liver is lazy and it's going to go through the path of least resistance. And the combination of the two, because they're both metabolized by the same enzyme cascade, the cytochrome P450, those enzymes can cause an adverse interaction and can cause a level of toxicity. And so we must protect the liver and obviously the patient. So for that case, in those instances, I stagger. Right now, I'm managing very closely a 15-year-old that is on Keppra and Depakote, both, and we started him on cannabinoids. And so I'm working with the neurologist and the parents who are divorced, and so that I'm now a counselor because,
Right.
but you have to be mindful of when to take each medicine. Keppra is metabolized in the kidney. Depakote is metabolized in the liver, and you've got the cannabis in place, and then you got mom and dad and different time zones and school, and it's like I'm dealing with Medusa, all these arms.
Yeah. So bottom line, what we teach here at Wakana, you're on medication, space those medications about 2 hours apart. Do not take them together, okay? So great question, Robert. When seeking a physician knowledgeable in CBD, is there a code, word, or reference to look for in a physician's practice description? Great question.
It varies from person to person. I recommend that people go to marijuanadoctors.com. I'm the chief medical officer for that group, and it's an excellent platform because it has a lot of education for patients. It has multiple conditions on there. So if you have a question about any specific condition, you can type in the conditions, and there's more than likely a report in there with some science related to it regarding how it works and why it works for their specific condition. And in there, you can also find physicians that are certified medical cannabis providers that you can, it can help. But typically it's just trial and error, calling the office and asking them, how does the provider feel about cannabis, or I'm using CBD? How does the provider feel about that? Because the staff will tell you, no, he's against it or she's against it. And so right off the bat, that you're, barking up the wrong tree. So, be mindful of that and just understand and screen them. They're working for you. You're the boss. You're paying their bills.
Right.
So, you find the provider that's going to work and understand what you're choosing to do.
We have a question about schizoaffective disorder and bipolar disorder. Again, when we talk about combining CBD products, making sure that there's a steady state in the body, not using just one product, but using the tincture twice a day, using the gummies definitely at night for sleep, and also using the smokables for those acute conditions or acute times of anxiety or panic. Is there anything else you want to add there?
Yes, the culprit with schizoaffective and schizophrenia is the THC. There's quite a few studies, and a lot of psychiatrists have an issue with the utilization of products that contain THC in those conditions, in those mental health challenges. However, regarding the CBD, it's innocuous. It doesn't have that same euphoria, and it doesn't have that same interaction as with the antipsychotics. So it's important to understand which of the phytocannabinoids can potentiate issues with schizophrenia and schizoaffective disorders.
Wonderful. Let's see if there's another question. We did that. Oh, blood clots. CBD. Can CBD help shrink blood clots in the legs?
Well, before COVID, back in 2004, I suffered a pulmonary emboli. I had a blood clot in my lung from a red-eye flight from Salt Lake City, Utah to San Juan, Puerto Rico, and back again. At that time, I was smoking cigars. So it was the cigar smoking and that red-eye flight that screwed me up. After COVID, because I contracted COVID in June of last year, I've had 2 TIAs, transient ischemic attacks, 2 mini strokes.
Oh,
The
wow.
second one causing me to lose consciousness. I lost consciousness in both, but the second one I fell and cracked my skull open, and I ended up with 4 staples. When I went to the emergency department, they checked my D-dimer level, which is the levels to see how checks for the presence of blood clot in your circulatory system, and my D-dimer was elevated. So post-COVID, and there's research showing that it can increase the probability of clotting in your body. So that's one of the issues with COVID. CBD is considered a blood thinner, and it can, when combined with Coumadin, also known as warfarin, can cause challenges or issues with the INR, your ability to coagulate, which is why when people are having surgical procedures, we recommend that they get off of the CBD or the cannabinoids 5 days before and 5 days after the procedure, because of the possible interaction and coagulopathies. So be mindful of that. But I was obviously put on medication to help with the blood clotting situation, but also I obviously am a user of cannabinoids, and so I monitor myself and I make sure that everything's in check. But this is coming from someone that has had blood clots in their lungs and in their lower extremities, and post-COVID has had an increase in the coagulation in their body.
And continue to use his cannabinoids. So
even though I am on an aspirin, even though before the aspirin I was on a medication called Agrinox.
okay, so we always teach, and we all know that our Wakanapreneurs here, that if you're on Coumadin or warfarin, same medication, that you talk to your doctor. You'll have to get more frequent INRs to make sure everything is safe. Okay, so I want to thank you so much for joining us. Our time is up.
Already? I was just getting warmed up.
I know, it's already up. But guess what? What we're going to do now is we're going to share the slide for 8 o'clock, because at 8 o'clock, my colleague, Dr. Joy Smith, is going to be presenting an overview on the Wakana business, the opportunity, and products. So if you are a guest on the line, you can join us in about 6 minutes. You can also reach out to the person that invited you on this call so that you can get these amazing products in your hands as well. I do want to also share with you, again, Dr. Joseph Rosato's book. You absolutely want to order this book. Can they order this on Amazon?
Yes, it is available on Amazon in English and Spanish. So
English and
for
Spanish.
those of you that have family members that prefer to read in Spanish, or you prefer to read in Spanish because it was your first language and you understand better in Spanish as opposed to English, then it's available. And before anybody asks, unfortunately, no, it is not available yet in Audible, because I was going to record it last year, but COVID had other plans for me and it shut down the studio where I was going to read my books in English and Spanish and record them. So as of right now, they are not available in Audible or audio.
That's okay. They can order it from Amazon and read the book. Well,
Or
thank
Barnes
you
and
so much.
Noble or Kobo.
Wonderful. We would like to know how we can contact you, because there's some people in Florida that are looking for a physician that is an advocate for the cannabis plant, for CBD, for cannabinoids. So how can they reach you?
Sure. They can go to my website, josephrosatomd.com. That's josephrosatomd.com. Or they can shoot me an email to my personal email address, info@josephrosatomd.com, info@josephrosatomd.com. I see cannabis patients on the weekends, Friday afternoons in Daytona Beach and Saturday mornings in Orlando. The rest of the time, I'm the medical director at federally qualified health centers where I do not see patients. I oversee providers and medical assistants and nurses, etc.
That's what I'm talking about. He oversees that. So thank you, Queen Neff. Queen Neff did put in the chat box his information, info@josephrosatomd.com. That is a great contact. Thank you, all guests that are on the line. I want to thank my guests, Dwayne, Robert. I know I've got 2 guests on the line. I want to thank our business partners for joining us, our medical advisory board, Dr. Kim Smith and Dr. Joy Smith, both are on the panelists. But again, Dr. Joseph Rosato, you are knocked it out the park. We want to thank you. God bless you. Continue to do great works in the industry. Continue to heal those that are looking for natural healing. And hopefully I'll see you when I'm in Florida. I'm in South Florida.
Yeah, you need to come up, girl. You're too far down.
I know.
Anything south of
Let's
Broward
meet in the
County, I
middle.
don't mess with. So come on north.
Okay, I'll come north. Well, good night. We'll see everybody in 2 minutes on the 8 o'clock call.
Bye-bye.
Bye-bye.